Can mental illness be cured? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of reviewing the risks versus benefits of psychiatric medications and using them as a tool to manage symptoms while you're working on targeting root causes of mental illness. And one of the questions that has come up is, can we actually cure mental illness? So I think before we get into this discussion, it's important to make a distinction between two different types of mental illness. So there are people who technically meet criteria for our mental health conditions like major depressive disorder or generalized anxiety disorder, but their symptoms are largely related to situational and circumstantial things that have happened. And if you are to remove the situational stressors from their life, then their symptoms improve. Of course, there are times when it's not so easy to remove these stressors. You're in a toxic relationship or toxic work environment. You're experiencing homelessness or financial insecurity. You have deep-seated trauma that you need to work through, but it's really challenging. But if they could remove these situational stressors, it's very likely that their symptoms would go into remission. And so in that way, if you ask, well, is there a cure to mental illness for these individuals? I might argue that they don't really have a mental illness per se to begin with, meaning that they don't have some biological differences that are causing their symptoms. This isn't to say that they're not suffering and that they don't need help, but in these individuals, I don't see it as a chronic condition that needs to be managed. Then on the other hand, you have those individuals who have severe and persistent mental illness. I'm talking about things like severe major depressive disorder that's recurrent, schizophrenia, bipolar disorder. And for these individuals, yes, situational stressors may contribute to their mental health symptoms or a psychotic break or destabilization of their mood. However, they also are vulnerable to these conditions with or without those circumstantial stressors. No, I don't subscribe to the chemical imbalance theory, but I do think that there are some fundamental biological differences in the way that the brain works in these individuals. Does that mean that they have a chronic disease that can't be cured? I think I would liken this to something like obesity. There are people who have a predisposition to developing obesity, which means that they cannot eat the same diet as someone else, have the same level of activity as someone else, and maintain a slim figure like someone else. They have to make changes to their diet and lifestyle in order to avoid being obese. And a healthy weight for them might not be what we would consider in the healthy range for everyone else. Similarly, with people with this kind of severe and persistent mental illness, they're always going to have a predisposition to having these mental health symptoms. That being said, there are things that we can do to optimize their mental and brain health so that they can live full, functioning, and thriving lives. So what does this look like? Well, when we look at optimizing someone's brain health, we're looking at their metabolism and specifically their mitochondrial function, because mitochondria are basically the metabolism hubs of the cell. So what does this look like? So certainly this is going to involve things like regulation of circadian rhythms, elimination of toxins, which might include substances or plastics or pesticides or other environmental toxins, optimizing sleep, as well as diet. Diet is huge, and I can talk more about that in another video. Managing stress, and along those lines, making sure that you have good social connections with others, and making sure that you're engaging in regular exercise. And of course, these things are also going to be helpful for those individuals who have more situational symptoms as well. Now, if someone with schizophrenia does all of these things, does it mean that their mental health symptoms are going to reverse or improve? Not necessarily, but I guarantee that they're going to have some kind of positive effect on that individual. For people in this category, they may need to consider a more drastic metabolic intervention. So something like a ketogenic diet, which we have growing evidence to show that it can be really effective in treating serious mental health conditions like bipolar disorder, schizophrenia, and severe depression. And if you're interested in this, we can definitely talk about it more. But at the same time, would we say that this is curing their mental illness? Well, I think it goes back to the same analogy with people who have obesity. They have to permanently change how they live their life in order to prevent those symptoms from coming up. So I think it's more about looking at it as a genetic vulnerability and how do you optimize your brain health, your life situation in order to be able to live your best life. So I don't think it's so much about whether or not mental illness can be cured as whether or not mental illness has to negatively impact your life. And to that question, I would say that there is always hope that symptoms can go into remission and that people can live the full, joyous lives that they want to. If you have any thoughts about this, feel free to put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.